everyone. So thank you so much for joining tonight's Spark session with Dr. Shinika and Dawn Payne. You guys are really in for a treat. Dawn is my line sister, as well as a number of other wonderful things. So before we get into it, I'm just going to give you guys just a little bit of information about her because she is so dynamic. So Dawn earned her bachelor's degree in sociology from Winston-Salem State, and she has a master's of social work from UNCG. She is also a veteran, so thank you so much, Dawn, for your service, and is highly decorated and has received numerous awards from the Marine Corps. Oh, she's a Marine, so she's a strong Black woman. Love it. After serving time in the reserve, she decided that she wanted to pursue a career in mental health. And Dawn is actually a licensed psychotherapist for the U.S. Department of Veteran Affairs, where she is currently employed. And her connections in the military is really also supports her love of beauty products. And so she is also a makeup artist. And one of the reasons Dawn is here today is because she is the owner of Dust to Dawn Cosmetics, which is a makeup studio located in downtown Greensboro. She is a celebrated New York Fashion Week makeup artist and has been featured in many publications. Dawn is also a member of Alpha Kappa Alpha Sorority Incorporated chapter in Burlington, North Carolina. Like I said before, Dawn, the beautiful Dawn, is one of my line sisters, and I love her so much. And her passion is really about beautifying people from the inside and out and making sure that whatever it is that they love always shines through. So I'm so excited to have you on this evening. So we're just
Thank
going to get
you.
into it. But before we get started, just tell me a little bit about yourself.
Okay, so I'm originally from Fort Knox, Kentucky. My dad was in the Army, so I was born there, but we moved to Burlington, so I was raised in Burlington, so not too far. I currently live in the Triad, Greensboro, Winston-Salem area. I have an 8-year-old son. His name is Jace. If are my friend on Facebook, you see him all the time. He's my pride and joy. Let me see, I have 3 sisters, an amazing mom, and I'm just a family-oriented person. I like to travel. My love for makeup and mental health just all goes together. I do like crafting as well. So I'm a person like you, Shanika. I like to have a little craft space. You have a craft room, but I have a little
Right.
craft space and to make things, wreaths and just anything DIY. Like I love to decorate, interior design. That's my thing too.
Yes.
Yes.
One of these, maybe I'll actually make something. I have a funny story. I was going to make macaroons and record myself one day, and then I realized I needed a whole different piece of equipment that I didn't have to do
Oh
that. So,
gosh. Oh
it's like
Lord.
back to the drawing board, maybe next
Right.
time.
Yeah, let's do some cupcakes.
So let's get into it. Dawn, if you could describe yourself as any kind of light source, what would it be?
I would say a star, and not like a superstar, but like just a star. I find
Okay.
myself sometimes surrounded with people that are in the dark, which is a side of therapy and also a side of makeup. So not in the dark, like a negative space. Sometimes not knowing where they want to go in life, down on their luck at times, depression, anxiety, and having all these issues that encompass who they can sometimes be in a dark place. So I consider myself a star because I can shine and help guide them to where they need to go. And same thing for women come to me because they sometimes don't know how to do makeup and just are not proficient in makeup. So they come to me and I help them. So the name Dust to Dawn is like bringing you out of the darkness into the light. So I would consider myself a star.
Yes, I would consider myself the sun, so that's a star as well. So,
That's it. That's it.
so
I love
yeah,
it.
and I would agree. Dawn has a very warming personality. She's very welcoming, and she does. She
Mhm.
makes people feel beautiful. So thank you for that. Dawn, can you tell us about one, I guess, what made you start Dust to Dawn? And then the other piece of this question is what made you want to become a psychotherapist?
So as far as Dust to Dawn, it started out of a sheer need for makeup products that didn't break me out. I would find myself going to, I hate to call names of places like Clinique and MAC and all these other places, even Chanel, like the expensive
Hmm.
stuff. I would buy it and it would literally break me out. And it wasn't until I went into seeing what items or what products were used to create that particular makeup. And I found that there were a lot of fillers, a lot of parabens, and just a lot of products that were so harsh on the skin. And so in my research, I'm like, hey, I would like to create a cosmetic line that's safe for people that have sensitive skin. I want to create a makeup line that doesn't have all those parabens, all those dyes, and all those things that will make the average person, not even our average person, somebody that has sensitive skin, just break out. So I said, let me just get with this company, and I got with their chemist and helped to facilitate the process of making cosmetics. And so from there, it just stemmed from my need. I would literally have rashes and would break out in hives from using foundation, from
Right.
companies that said it was safe. And I'm like, I need to find something that is going to help me. And so I said, I know if it's safe for me, it's safe for the average person. So from there, Dusted On Cosmetics was born. I started using it on myself. It was safe for me. And then I branched out and started using it on my clients. Loved it. And so I said, hey, if they love it and I'm using it, I using some of this stuff on New York Fashion Week and using this stuff in movies and on the sets of commercials. I could use this stuff to help the average person. So that's where it started from. And then as far as, what was the second question, Shinika? What
What
made
made
me
you?
become a psychotherapist? Yeah. So my sister was a social worker for DSS. And she kind of got me wanting to be in the field. And once I joined the military, seeing veterans to have issues with PTSD, anxiety, and depression, it made me want to take it a step further. So I followed in my sister's footsteps, and she has a bachelor's, but I wanted to get a master's so I could do therapy and do that psychosocial piece. And that's where it kind of started, from my sister and then the military. Seeing folks coming back different from war and things like that, it kind of made me say, I want to help. So that's how it got started.
Thank you for sharing your story.
You're welcome.
Okay. So, what I really want to get into tonight, which I think is very important, is again, the name of our session this evening is Skin Deep, Dispelling the Myth of the Strong Black Woman. And so, let's talk about the Strong Black Woman Syndrome, which kind of some of the things that what that means is that a lot of Black women struggle with being a superwoman as a necessity of survival. They're nurturing and caring for everyone except themselves, and this impacts their health and stress levels. Being a psychotherapist and you actually having a mental health background, let's talk about the strong Black woman syndrome and the need for Black women to feel like they carry the weight of the world on their shoulders.
Yeah, this is a topic that needs to be discussed because a lot of people just simply don't talk about it. And actually, the research for it is very limited. You have some research from back in like maybe 2012. You have some research from 2008, but nothing really recent. But basically, the Superwoman is the conceptual framework is basically the characteristics of the Superwoman complex are an obligation to manifest strength. That's number one. It's like in 5 stages. So the Superwoman role is when you have to manifest strength. That's number one. Number two is when you have to suppress your emotions. Number three is the resistance to being dependent or vulnerable. Number four is the determination to succeed despite having limited resources. And then number five is the obligation to help others. And so if you break all of those down, you have a historical legacy of racial stereotyping with women, and it stems from oppression. We can really go back.
Slavery,
Yeah, slavery, how we,
Jim Crow.
have to be. Yeah, exactly. It kind of, we hate to take it back that far, but you have to talk about the roots of where this stuff came from. It is. And so with the Superwoman role, we think about the lifelong legacy of Black women having to step up, breastfeeding babies, taking care of the home, being the person that is cooking, cleaning, and rearing children. It's just something that has had us oppressed in a sense. And so we also talk about our parents. You
Right.
think about your mom and your grandma. Did you see your mom fold? Did you ever see your mom fold? I can
No.
guarantee everybody on this live is going to be like, nope, you didn't. We had to be strong because we didn't have any other choice. And
Right.
so the main thing with the Superwoman complex is that it's a history of disappointment, mistreatment, and sometimes abuse. And we've gotten to the point where we have to feel like we have the world on our shoulders, and we have these spiritual values. A lot of times we use religion and church as a coverall, and that's just not fair. We can,
Nope.
take off the cape. We need to take off the S on our chest and we need to go to therapy. And I think that those are the things that kind of make everything so much pressure on us because we literally, and I forgot who said it, but Black women, we save the world
Right.
and we don't get enough credit for it. And we're over sexualized and so much that goes into being a Black woman. And and there are some benefits. So it's not, like all bad. There's not, everything is not bad with being Superwoman. I would say the one thing is that self-survival, self-preservation, we have to preserve the African American community and we have to preserve our family structure. And so it's not a bad thing to be in the Superwoman role, but you also have something called maladaptive perfectionism. And just being transparent, that's something that I suffered from. It's basically an over perfectionism type of mind state where you have a preoccupation with your past mistakes, you worry about the future, you worry about how you look to other people, and you have these high expectations that you set for yourself that are sometimes just unrealistic and unreachable. And we have this sense of being indestructible when we are really delicate flowers and we need to treat
Right.
ourselves like delicate flowers. So this perfectionism standard that we have it really is destructive and it aids in our Superwoman complex essentially. And just to piggyback off of what I said earlier about how the Superwoman complex can affect our families, it also affects our interpersonal relationships, our relationship with men, our relationship with our children, our relationship with our employers, feeling like we have to literally be all, because if we're not all, then somebody else can be that all that we should have been and they can get ahead of us. And
Right.
so it's really just all a mind game and it's an embodiment of a stress that we have put on ourselves, also society has put it on us.
Awesome. Thank you so much for that.
Mhm.
So you said a lot. I want to
I
come.
did. I just kept I'm like a waterfall.
No, that's great. That's great. So I really just
Mhm.
want to come back to touch on some of this, especially when you talked about the 5 signs of recognizing this. And so
Mhm.
the first one you said is manifesting strength. And I think sometimes we put on from a strength perspective because that's all we know how to be is strong.
Yeah.
So what would be your thoughts on how do you recognize when it's time to open up and be vulnerable or if it's time to let go because the weight is too heavy?
Yeah, when the weight becomes too heavy, that's when you want to let it go. When it starts to affect your daily functioning, which kind of goes in a line with being able to be diagnosed officially with depression and anxiety and things like that, whenever it interferes with your everyday, your day-to-day activities, and you're not able to fulfill your role as like a mom, a wife, a daughter, and things like that, it is time to seek help. And I think we talked about it before when Tava was on, we talked about burnout, but
Right.
burnout is your environment. It's a symptom of being depressed. And so you have your environment that can create the way that you feel, which is burnout. But then you have depression that is it's an actual mood. And a lot of times it's hereditary. So when you talk about manifesting strength in that way, we are always taught to manifest strength on an outward basis, but inside we're dying. Yeah.
Okay, great. So let's talk a little bit about, and you touched on this very briefly, but I want to come back to the church and
Mhm.
prayer and mental health and therapy, because I think in the
Mhm.
Black community, there's such, and I'm glad that I actually have a mental health professional on this evening because I really want to talk about this. In the Black community, they tell you all the time, pray about it. And sometimes prayer is great, but sometimes you really need to go talk to someone and really see about yourself and your mental health. So, what would be your thoughts around separating out the prayer piece to actually taking care of your mental health?
So I believe that you can have Jesus and a therapist because that's what I have. I'm a therapist. Oh, Tava literally just said you can have Jesus and a therapist. It's true. I think somebody even had a t-shirt about that. And I actually did a talk last year that was called You Can Have Jesus and a Therapist. And
Okay.
it's so true because Jesus is, if you're not Christian, this is not for you. But if you are a believer, then Jesus is the source of everything. And we can go to him for things. But also, Jesus gives us the wherewithal to do things for ourselves. So that's when we have to step in the physical sense and say, okay, well, prayer can be enough because that's what you believe. And we believe that God can change things, and he does. But you also have to have action, because faith without works is dead. So you can
Right.
believe all day. I can believe that this pen is going to turn pink. Well, it's not going to turn pink unless I dye it and dip it in some pink. So it's the same thing with mental health. You have to be able to put some action behind it. And I think the fact that in the Black community, it has been just such a stigma around mental health that, that you're crazy, that Jesus can fix it all. And yes, I know that he can, but it also takes hard work. And that means going
Right.
to therapy. It means recognizing some of the maladaptive behaviors that we have within ourselves that are holding us back. And until you do the hard work, nobody's going to step in and do it for you. So that's one of the things that I firmly believe, that you can have both. You can be a Christian, you can pray about it, but you can also make action. And I encourage everyone to create an action plan. When you go to a therapist, it's not just sitting down and talking about random things. It's very much a session that can be, just depending on the type of therapy you do, it could be very structured. You can tell your therapist what your goals are, and you meet and talk about those specific goals and how to eat an elephant by biting off one piece at a time. And so having that person to guide you through therapy is just like having a pastor is a person that's going to guide you through religion
Right.
and help you get through with Jesus. Your therapist is going to be the person to help guide you through in the physical world and teach you how to become more mentally strong. And I think that it's necessary for us to have both. I'm a therapist, I have a therapist, and it's necessary. And
So
I
this
have
was
Jesus too.
Yeah, so this is not one of the questions I had on my list, but I think it's
Mhm,
important for me to ask because
mhm.
how do you find a good therapist? What do you look for if you recognize you need help? What does that process look like?
One of the platforms that I specifically, because everybody that's watching has heard the introduction. I work at the VA hospital. So if you're not a veteran, you can't see me. But if you are like the average person, there's a platform called BetterHelp, BetterHelp, betterhelp.com. And what that is, it's an online platform that allows you to do therapy. Now, what you can do is go on to the platform and pick your therapist. There's a picture there. It talks a little bit about who they are, and it talks about what they specialize in. And so if you have someone that specializes in cognitive behavioral therapy, which is something that helps for depression and self-talk, that would be good. If you are struggling with like a borderline personality disorder, you might want to get somebody that does DBT, which is
Hmm.
dialectical behavior therapy. So all these things that you're struggling with, you can just simply Google what method of therapy would help for this specific issue, and then pick a therapist that you recognize the acronym CBT, DBT. If you have PTSD, the acronym would be EMDR. So literally just going to Google and trying to figure out how to connect what you're experiencing as far as anxiety, and how to get with a therapist that specializes in anxiety. So that's the main thing. I think that is the easiest way. Sometimes when you have insurance, the insurance companies pick it for you, and that's not
Yes.
necessarily the best. BetterHelp.com is like, it's self-pay, and I think they accept some insurances, so you can go that route. And if not, if you do have insurance, go through whoever your insurance company is, and then just do a quick Psychology Today scan, and it'll give you like ratings on that specific therapist. That's another way of finding a therapist. And most people platforms come with a picture, so you can see if you want to talk to a Black female, she's Black. If you want to talk to a Black male, they're few and far between, but they're still out there. And also for kids, as far as like teenagers and college kids, I always have to say, go on campus, because that is going to be free for you. So if
Right.
you're like in college, if you're in your college years, utilize your counseling center on campus, because it's built into your tuition.
Thank you for that. And then
Hmm.
just one more question, just around because you talked a little bit about the insurance piece. Do
Hmm.
you, if you're struggling and you need to, do you have to typically go through your primary care provider for a referral for therapy?
Yeah, yeah. Typically, I guess it just depends. So, say for instance, at the VA, if you are having a mental health issue, you go to primary care first. But
Hmm.
I know with a lot of insurance companies, you can simply just call your insurance to see who covers mental health, and they'll give you a list and you literally just pick from there. But if you are having mental health concerns, you want to definitely tell your primary care doctor first, and they can make referrals. But sometimes the referral network is limited because they don't know who your insurance accepts.
Right.
Yeah.
Thank you.
Yeah. So sometimes you may need something called pre-authorization. If you go to the doctor, the primary care physician, and they say you need pre-authorization, that means that they're going to have to do the referral for you. If it's just open, you can just pick anybody from the list that your insurance company gives you.
Thank you. So
Mhm.
it's important for you all, if you check your individual insurance. And again, we're both of us are proponents of therapy. I feel like it's needed. Like, therapy changed my life. And I feel like, again, this is not something that we talk about enough in the Black community. And we just carry so much weight as Black women. So again, make sure that you see about yourself and that you take care of your mental health, because you can't take care of anyone else if you're not taking care of yourself.
That's right.
Which leads me into my next question, Dawn. How does the
Mhm.
need to be strong all the time impact our mental health?
So there are a lot of health disparities when it comes to Black women specifically. We have higher rates of depression. We have autoimmune disorders that can form. We have adverse birthing outcomes. We have all these things can be explained because of our lack of being able to cope. And so it
Right.
starts with us experiencing those types of issues. And then once we start having the issues, we have to report them to our doctor. So stress, and people say this all the time, stress can kill you.
It
Stress can
can.
really it can literally kill you. And this is not just I'm upset, I'm having a bad day. No, this is like depression. This is like serious stress that causes autoimmune disorders to pop up, lupus and things like that. So it's very true and it's very serious. We have to take care of our mental health because our mental health affects our body. And when we talk about, how how it affects us in general, we have to talk about the physical aspects of it. And the mind and the body, they're so connected. If you're not getting
Yes.
enough sleep, if you're not exercising and getting your endorphins going, you can really be in a low state, and constantly functioning at a low state, it puts you at a low vibration. And it's
Right.
a person that believes in, and I'm a Christian, I believe in spirits, energy, and all that stuff. But if
Hmm.
you are functioning at a low space, you're going to vibrate lower. And then you start to actually attract people that are on this low vibration.
Right.
And when you stay there, you're just in this cesspool of like lowness. And once you
Right.
stay there, yeah, your body gets used to being that low. And so all these health issues start to happen. But once you start taking better care of yourself,
Hmm.
getting everything aligned and getting everything in order, your body responds to that and you literally get better. We can make our own.
And I would agree with that, because, I tell people all the time, like, mindset is everything. If you change your thoughts, you change your life. And just going back to what you were talking
Mhm.
about with energy, if you're constantly in a negative space and complaining, like, that manifests in your body, that impacts your
Yeah.
health, that impacts your mood. Just be aware
Mhm.
of how you're talking to yourself and the thoughts that you're keeping, because that can also
Mhm.
be something that impacts you in an adverse way. So,
Mhm.
Dawn, Tava and I talked a little bit about this last week, but I really want to get your thoughts, being a licensed mental health professional. Can you tell me about the difference between burnout and depression? Because I think
Yes.
those are two totally different things.
Yeah, so they are similar but separate. The main thing is the cause. So you have burnout, and burnout is basically where you are having a reaction to the severe stress in your environment,
Okay.
whereas depression is a disorder of your mood and your state. So you can have the same symptoms with depression and burnout, such as sadness, fatigue, anxiety, and all that stuff. They share the symptomology, but the difference essentially is the cause. So when you're
Right.
depressed, it's because of your low state mood, but then when you're burnt out, it's because of your environment and basically how you feel. So it would really just be the cause. That's the major difference, because we
Okay.
talk about depression and that's something that could be hereditary. So being burnt out, that's not hereditary.
Yeah. Okay. Cool. Thank you for sharing that. I just want to get
Mhm.
some clarity on that. And I think that makes a lot of sense, that they would share similar systems, and one could, I would assume that the burnout can stem to
Yeah, and
depression.
Yeah, and that's true. And just to be like more clear, because sometimes people think, oh, well, I'm just feeling sad today, I'm depressed. No, there's a clinical side of it, just to get a little bit more clinical. So, in order to be diagnosed with major depressive disorder, you essentially have to have 5 characteristics for 2 weeks or more. And the number one is you have to have a low mood, which means just a loss of interest in like everyday activities. That's number one. Number two is a feeling of hopelessness, emptiness, or worthlessness. So that's number two. Number three is a feeling of guilt or irritability, changes in your eating habits, and then also, let's see, the last one is, yeah, just feelings of emptiness. So you have to have 5 of those. I think it's maybe like 7 I listed, but you have to have 5 of those
Okay.
specifically in order to be diagnosed officially with depression. And you have to have them for 2 weeks or more. So you can't just say, oh, I'm having a bad day. That's not depression. It has to be like clinical, which is considered 2 weeks.
And just coming back to depression, there's nothing wrong with taking meds for depression if
Right.
you're struggling.
Absolutely.
I,
Because
I
studies,
just
yeah, 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 because studies show that as far as depression, anxiety, any type of mental health disorder, that medication and therapy work best in tandem. Now, you
right,
can go to therapy and you can do fine, but if you take therapy and then you take some meds, your outcomes are way higher. And the other thing is the stigma. I know you were probably going to chime in there, but the other thing is the stigma attached with taking medication. We feel
right,
like we're weak. We can't, you're crazy. No, how about it's a mental health disorder that is an imbalance that's in our brain, that's genetic, that is in our makeup. It's not just something like a shirt, like I'm going to take this shirt and take it off. No, depression is not something you take off and put on. So in order to
right,
in order to go ahead and treat that, you have to start internally. And it's with self-talk and also with therapy. And then medication is the other piece.
right, right. Yeah, I'm gonna be totally transparent. I have seasonal affective disorder. Like I need sunshine. I take my
Yes.
Wellbutrin, and it
Yes.
makes me feel good because probably about 3 years ago I had a incident where I was just in a slump. And anybody knows me knows that I'm high energy and I'm just like a ball
Mhm.
of energy. But I just couldn't, like, I was just sad.
Yeah, yeah,
and
literally what it is. You are what it is. Yeah. And I have seasonal affective disorder too. Like right now is like the saddest time of my life, just simply because there's no sun, dark,
and it's
and it's
cold.
cold. I'm like, I'm over it. Where is the sun? Take me to Florida. You know?
But again, I think it just goes back to acknowledging that something is off. Like, you of all people know how you're supposed to feel. So again,
Mhm,
I just want to remove some of the stigma around mental health issues, because I think it impacts all of us, and it's something
mhm.
that we've got to take care of so that we are taking care of ourselves. What advice would you give other Black women about taking better care of themselves and prioritizing their needs in, like, kind of the hustle and bustle of their crazy lives?
Yeah, I would say you have to take time for yourself. And some people feel like that taking time for yourself will take away from being productive. And that's simply not true. Taking literally 15, 20, 30 minutes to yourself to just center yourself, to either pray, to just sit there and do nothing, to meditate, just to de-stress, especially in the middle of a workday. If you can get 15 minutes, that is prioritizing yourself. The other thing is being kind to yourself and just acknowledging that you are doing your best. I
Right.
think sometimes we don't talk to ourselves enough. And then
True.
the most times when we talk to ourselves is negative. And you
Mhm.
have to think about the implications that negative self-talk has. It will keep you down, and
It
we
will.
become somehow our own worst enemy, and we're our own worst critic. So I think prioritizing ourselves, 15 minutes, 30 minutes, just you doing nothing but thinking about de-stressing is great. Being kind to yourself, acknowledging that you're doing great, being realistic and setting realistic goals is something that is going to be great for us. So I can say, hey, yeah, I want to sell 1 million lipsticks in a day. Yeah, that would be great. But Dawn, how about let's start with 30? Let's sell
Right,
30
right.
lipsticks in one day. Let's be realistic, because if we're not realistic, then we put undue pressure on ourselves. And the other thing that I just wanted to throw in there, because I'm super transparent, that sometimes I talked about having maladaptive perfectionism myself. Sometimes we think that we should be doing these things based on the voices in our own head. But it's like, wait, okay, I have this deadline of what I want to do, but Nobody else knows about the deadline.
But
So I'm beating
you,
myself up about it. It's, wait a minute. You can do that later. You can put that on the back burner and let's focus on these other things. So I think talking to ourselves more positively is a great way. Sometimes getting off of social media is extremely helpful. That's another way to, because they all the time say that, what is this, comparison of joy is a stealer of joy. Comparison is a
right,
stealer of joy. And so sometimes we think, oh, I want a new car. So everything you see on social media is a new car. Oh, I'm single. Well, everybody's got a boo but me. Oh, I want to lose weight. Well, I see all these people working out. Sometimes you have to put social media down because it can be a negative thing for us too.
right,
So all those things I think can help us to prioritize ourselves. Being self-centered is something that I think is the least selfish thing you can do. Like
right.
having time for yourself and creating time specifically for you is what you have to do to stay sane. It's not a choice at this point, it's a necessity.
I would agree. And you said a mouthful there. So one of the
I always
things,
do.
look, it's good stuff though, and I think it's well needed. But I want to come back to the mindset piece where you talked
Mhm,
about being your inner critic, because one of the things that I like to coach on is mindset, because I think
mhm,
everything starts there, and we can. I tell people all the time, you're the thoughts that you keep, and change your thoughts, you change your life, and that's positive or negative. And so, like you were talking about, sometimes we have this, because I struggle with perfectionism as well, and I think we have to recognize that perfectionism, imposter syndrome, self-doubt, and fear, all of these are inhibiting behaviors that are that are
mhm.
rooted in something, and they're stemming from somewhere. So sometimes you have to pause and really look and do that inner work to look within yourself to figure out where is that coming from, because at the
Yeah,
end of the day, I think we each are exactly where we're supposed to be at this point in time. But at any given time, you can take the steps to change the outcome of your life. But again, you have to have an
mhm,
awareness, have that emotional intelligence to have an awareness of where you're at, and be real with
mhm.
yourself. Do you have anything you want to add before I go on?
Honestly, Shanika, letting go of what other people think and letting
Right.
go of what other people think we should be. That's like number one.
Hmm.
That is, and we have to also deal with why we feel selfish, why we feel bad putting ourselves first. How are we dealing with these feelings of feeling unworthy and things like that? We got to get past that. And I say that not just laissez faire. I say it meaning that we literally need to get past that because that's the barrier. It's the block. At church the other day, my pastor was talking specifically about how when we go throughout life, when things happen to us, we put up these walls.
Right.
And these walls are where we live inside of. And so if you are building a wall every time somebody does something to you, she talked about me, I'm going to build a wall. Okay, they said I was this, I'm going to build a wall. He rejected me, I'm going to build a wall. And we have this wall that we have up, and it's like impermeable to get down. Actually healthy people in our life and healthy relationships that should be formed, we don't get to form those relationships and we don't get to progress in that way because we have all these walls up. And so prioritizing ourselves and doing the work to get the walls down is what's going to help us to be successful overall, you know?
Right.
Yeah.
And something I had to work on recently was establishing boundaries with people.
Yeah.
And I think boundaries is a big part of self-care, because sometimes you try to be everything for everyone, and you end up being the one that's self-depreciating in that
Mhm.
mind, and that just dealing with that. So I just want to reiterate that it is okay to say no, and really anything you're doing in life, it should be rolling back up into what your bigger purpose is, because if it's not aligning in your individual purpose of what it is, whether the vision you have for your business, where you're trying to go, your goals or whatever, then why are you doing it?
Mhm.
Like, being busy
Exactly.
for the sake of being busy is not cool,
No.
because you're just going to run yourself in the ground.
Yep.
Yeah, so I think boundaries
Yeah.
are important, and it's okay to say no, and it's just no. There's no if, ands, buts, or anything
That's
behind it.
right.
No, like, I'm at a point in my
Yeah.
life and it was hard to get here, but I don't do things that I don't want to do. If I don't want to go, I'm not
Exactly.
coming. Like,
Exactly. Sorry, I just
like,
can't. Yeah, I don't even owe an apology. It's just it is what it is. It's
like,
true, and
no,
I yeah, and I think saying no is one of the things that's essential in getting out of that Superwoman syndrome. Because the
right.
Superwoman she's gonna meet every need. Where was Superman at? He was on every set. Superman was everywhere. If somebody was in a tree, if somebody was over here, he was everywhere. So we got to take the cape off, take the mask off, and we got to be free.
You got to let people save themselves. You cannot save
That's right.
everyone, because if you're constantly saving people, then they never figure it out for themselves. And one of the
No,
things I had to look at myself and ask, okay, if I don't show up or if I don't step in, what'll
what's going to
happen?
happen?
And
Exactly.
they figure it out. Sometimes you have to step back because you can inhibit people's bad behaviors, and you teach people how to treat you. So
That's
we're
right.
trying to save the day. Let them figure it out.
Exactly.
That might
Exactly.
sound
And guess what?
harsh.
They always do. They will
Right.
always figure it out. If you don't go to work, if you take your mental health day, what's going to happen? The day will go on and they'll figure.
Because if you don't take that time for yourself, if something happened to you tomorrow, they're gonna pack your stuff up in a box and they might send it to you. Like your job
I'm
gonna be
telling
posted
you.
by the end of the day. Like these jobs do
Yep.
not sacrifice your health for these
Mm-mm.
jobs, because these jobs
Nope.
ain't loyal. Like they are
Nope. Nope.
not.
Nope. And I think too, we need to talking about jobs. We need to also explore personal development because we don't do
Right,
enough of that. I think that sometimes when we're growing up, we're taught certain things, but in adulthood, some of the things that we should know, a lot of people don't know. So taking
girl.
time for personal development, learning new things, putting yourself out there, making yourself uncomfortable. Because when you make yourself uncomfortable, that's when you find comfort in discovering new things and new ways to do things that you had no clue about before.
I tell people all the time, dreams go to die in the comfort zone, and you have to move out of the comfort space, because I tell people growth is uncomfortable, it's vulnerable,
Yeah.
it's ugly, and it's messy. So
Yeah.
when you're taking charge and you're stepping into this new version of yourself, you have to get uncomfortable with being uncomfortable. Because if
Yeah.
you're not uncomfortable, if your dreams don't scare you, are they big enough? And I think that it's natural to be nervous when you take on and try new things, but you cannot remain stagnant, because if so, you're
No.
going to get left behind and you're going to be doing the same stuff over and over again. And then what?
Mhm. Exactly. It's true.
Okay, I think we've talked a little bit about this, but I want to jump into it anyway. Why is self-care necessary, and what tips would you offer on practicing self-care to feel good about yourself?
Self-care is necessary because if you it's just very simple. If you don't prioritize and care about yourself, there's no way that you can be anything for anybody. The old saying, when you're on a plane and it's going down, what do you do first? What do they tell you
Put
to do?
your on.
Oxygen mask on. Because guess what? If you're dead, you ain't gonna help nobody else. You have to help yourself first. So literally, you have to save your own self. You have to show up for your own self, and that includes hard work. Talking about the things that you need to improve on and actually making steps to improve upon. It means having the hard discussions with people about things that they see in you and being receptive to those things. Because one thing about me is that I didn't think I was the one that was doing anything wrong. I thought it was
Right,
everybody else. And so when you have those discussions with people about how you can improve, it will improve your life. So I think
right,
I suggest being open to new experiences, being open to criticism, and not thinking that you know everything, just being
right,
more open to the possibilities of exploring other things outside of your normal everyday.
right. And I tell people all the time, I call it like being worldly or having
Hmm.
culture, because I'm a community person at heart. And like when you get into some of these communities, like a lot of kids and people don't get outside of like a 9 mile radius of where they live. And life is
Hmm.
about experiences. You got to
Hmm.
take time to learn something new, step outside of your box, try something different, foods, go to
Hmm.
different places. Like, there's so many more beautiful beaches than like Myrtle Beach. Like
Exactly.
like I don't know, like
Exactly.
I like clear water, like with white sand.
Yeah.
Get outside of your box, try new cuisines, go like I'm all about experiences. Life is about,
Hmm.
experiences, and expose yourself, because if not, you'll
Hmm.
find that in certain situations you may not feel like you can hang. Like I can show up and handle my
Hmm.
own in any room I walk in, because I am worldly and I'm experienced and I'm cultured. Expose your
Hmm.
children to things, talk to them. Like these are
Yeah.
things that are important. And I just thank God, like you said, to having these strong Black women as mothers. Like my mom, she
Yeah.
always made time that we went on vacation and we were exposed to things. Exposure
Hmm.
is very important. And even if you don't have kids, like if mentor and you show up in other people's life, give them the opportunity to be exposed to new things.
Yeah. Yeah. And we are our own most valuable asset.
Right.
So you have to prioritize yourself, and you have to just say, this is what I'm going to do. This is what's going to make me happy. If you're a mom, you have to, of course, think about your children. But in a way, sometimes even with your children, you have to be selfish, because one thing
Mm-hmm.
about a mom is that, listen, we care about our kids, so we're going to try to meet their needs. But okay, listen, little Johnny going to have to go to grandma's house this weekend because mom needs time to herself. So knowing that you are your own most valuable asset and that you can't help others unless you help yourself is like the number one thing when it comes to self-care. And I think that we don't practice self-care enough because we self-care is not a habit for us. So
Right.
habits cannot all, they're not all bad habits. You can have good habits, and I would say your number one good habit should be self-care. Yeah.
And I know for me, for example of one of the self-care things that I do, I get a monthly massage. Like I have a
Mm-hmm.
subscription. Like I
Mm-hmm.
prefer to do my massages on Sunday because that's a nice
Mm-hmm.
relaxing day for me. I don't have to worry about the
Mm-hmm.
stress of work. And again, carve out the time to make those things. If you like wine, you go get your favorite bottle of wine and take you a
Mm-hmm.
bubble
Mm-hmm.
bath and drink your wine and eat some candy. Like whatever
Yep.
brings you joy,
Yep.
make time and carve that time out. And it's nothing wrong with
Mm-hmm.
carving that time for yourself. And I want to come back to just, I don't have children, but I know
Mm-hmm.
like that moms, sometimes your identity gets lost in your family.
It does.
I think women that have children, you have to be very intentional in holding on to who you are as an individual. Of course, your kids and your husband are important, or your partner, whatever. But at the end of
Mm-hmm.
the day, you are also important. And so you don't want to have your life pass you by. And when your kids graduate, and then you're like, who am I and what do I do? So I think that having
Mm-hmm.
that individual identity outside of your family is very important. Carve out, make time for your girlfriends. So,
Yeah, yeah, because we feel guilty. It's a thing called mother's guilt, and
mhm.
it's true. We feel guilty about, if I go on vacation, it's like I'm not going to go on vacation for a week because I'm a mom. I can go for 4 days. A weekend is even better. But because I feel bad about leaving my kid behind, there's this fine balance between self care and actually prioritizing motherhood, which is what you're supposed to do. But like I said, if you're burnt out, you're not going to even be a good mom. So,
Right.
what sense does that make to burn yourself out? Probably turn into a bad mom, probably turn into like a worse wife that's like anxious and irritable and just unhappy. You're going to affect everybody around you. So it's best to take care of yourself so that you can better take care of other people. And just because you don't have a kid don't mean you're not stressed out either. Like, there's a lot of things that come with people's professions, their careers, being relationships, being a boyfriend or girlfriend, demands if you have a parent to take care of.
Right.
There's so many things that we are bombarded with on a daily basis as far as our external, like our families and jobs and stuff, that if you don't prioritize yourself, you're going to crash and burn. And what
Right.
good are you going to be when you crash and burn?
None.
A
Yeah.
pile of ashes. And then we're going to be talking about University of Phoenix rising from the ashes.
Right.
Like
Right.
we have to, yeah, we can do it. But that's, if you are more proactive and more intentional, then it's better if you're intentional about your self-care.
Yes, self-care is so important. I'm a big
Mm-hmm.
proponent of self-care and putting your needs
Yeah.
first. So,
Yeah.
Dawn, what advice would you share with your younger self?
That is one that I had to figure out how to answer, because
Okay.
some of the things that I struggled with as a young adult, those things can still creep up in adulthood. But what I would tell myself is just to continue to show myself grace and to be more open, because you don't know it all. When you're young, you're coming up, you're learning, you, you don't know it all. So you need a mentor, you need somebody that's going to pour into you and help guide you. So I would say to my younger self to latch on to someone else that is going down the same path. And for me, I did that with my sister, but then I also had this mentality like, well, I'm grown, can't nobody tell me nothing. So I
Right.
just would be more open to learning more things that I thought I knew that I really did not know. And just
Right.
continue to show myself grace. That's the constant struggle that I have, which I think sometimes, Shinika, that is a fine balance, because
It
having
is.
that drive can make you successful. But then the downside of it is that you have this standard that
You
only God can reach. You know what I'm
right.
saying?
You hold
So
yourself to unrealistic
it's
expectations.
exactly. And that's the thing. When you strive for the best, you can sometimes make it, but then you're not satisfied. You know what I'm saying?
Right.
So it's a fine balance, and you got to just use positive self-talk. That's what you always got to do. But my younger self, I would just say, show more grace and be open to hearing what others have to say.
And I think something's important that you said, the never satisfied piece. I think it's
Mm-hmm.
important for us to kind of touch on this is sometimes you got to stop and actually enjoy your accomplishments. And you can't just look at
Yeah.
life like a to-do list that you're checking off, because if you approach it from that perspective, nothing's ever going to be good enough. And I think, again, being realistic with yourself and the expectations that you put on yourself is this really restrictive, or do I have to be this granular, or is this something that's got some space and I can be flexible in? Like, one of the things
Mm-hmm.
when I was working on my dissertation, a lady said, she said, I prefer to be fluid over flexible, because flexible can only bend so far, where fluid water can go into
Mm-hmm.
anything. So I think with that being open, be more fluid in how you move in life, and recognize that at any given time the river can shift, or you can have a
Mm-hmm.
tsunami, or months
Mm-hmm.
the storm,
Mm-hmm.
but after every storm, you always have that rainbow. So just give yourself grace. And then, at the end of the day, we're still in the middle of a damn pandemic. Yeah, like everybody is doing the best that they can, show, and then we're just showing up every day. So I think don't be so hard on yourself, because we've got a lot. There's a lot going on in the world right now. You got a potential war brewing. You got poverty. You got
Yeah.
racism. There's just all these things that impact us. So again, you have to give yourself grace. And Dawn said earlier, don't cut the news off. Don't always be on social. Spend some
Yeah.
time with yourself. Sit in a room
Mm-hmm.
and quiet, light a candle, meditate, because that's how
Mm-hmm.
you really do the inner work to get a feel for what you need.
Absolutely. So
All right.
true.
All right, Dawn. So what would be your kind of main takeaways and lessons that you've learned that you would want to leave with our audience before we open it up for questions?
So I would say the main thing is take off the cape, take it off, take the S off your chest, and number 3, go to therapy. It's pretty simple.
Yep. So
Yep.
stop trying to please everyone. People pleasing will get you in so much trouble. So take that
Yep.
cape off, take time to, rest. And all of this
Mm-hmm.
is so important. And I think therapy, again, a big proponent of therapy here. Make
Yep.
sure that you go to therapy if you're not feeling good, if you're struggling. And I'm going to tell you why therapy is important before we open it up for questions. Is one of the things that I loved most about therapy was having a safe space to talk to someone that I didn't feel guilty about what I was saying, or if I was
Mm-hmm.
being judged, or if I was dumping, or it was just
Mm-hmm.
nice to have that safe space to have this conversation about how I was feeling, and to work through all the things that I was struggling with that I felt like I had to take care of. So that's
Yeah.
what I think therapy is important.
Absolutely. It is. And I think too, when you're choosing a therapist, it's important to sometimes choose someone that is a little different from you, because
Right.
sometimes if you pick somebody that looks like you, they can start to relate. And then you have this thing called transference and countertransference, where the therapist can identify with the client themselves in the therapist, and that's not beneficial. So you also
Right.
want to be careful when you're picking a therapist that you're selective about the person that you choose, because you'll be surprised at the person that you would mesh with. It's unlikely that I would mesh with an older white guy, but
Girl,
that's my thing.
Dr. Kirsch was the bomb. My therapist was an old
Okay.
white guy. And the best advice he ever gave me was, Shinika, it is not fair for you to hold other people to your expectations, because you're going to constantly be disappointed.
Disappointed. That's my flaw. That is
And
every time what's my weakness?
yeah, and
Having
I
high
think
expectations for people and they don't meet them and you're disappointed.
everybody
Gotta
ain't gonna
correct
show up
that.
the way you show up, and that's okay.
Exactly.
You can't hold them
Exactly.
to that standard because it's unrealistic, and they don't know that
Mhm.
you're expecting them. So you can't expect you out of other people, because you're the only person that's going to show up as you. And I think high achievers Dawn and I are both high
We
achievers.
are.
So,
Yeah.
I think with high achievers that you expect, because I would do this for you, you expect people to extend you that same grace. And most of the time it's not gonna happen. So you
Mhm.
have to be okay with that. But that changed my life, and it helped me
Yeah.
manage my expectations of other people a lot better, because I wasn't being let down as often, because you expect
Yep.
nothing from no one. Nobody owes you anything at the end of the day.
Exactly. Exactly. And then too, the second part of that, Shanika, is that people are going through stuff themselves.
Right.
So you're expecting stuff out of people and they can barely even get up to go to work in the morning. You know what I'm
Right.
saying? They stressed out about how they're going to pay a bill. The kids got them stressed out. The work is giving them a problem. They coming home and can't even think. Listen, people have their own stuff going on. And the moment that, you and I, these high achievers, let go of the standards we have for people, that's A1 right there. That's what helps us keep going, to just be accountable for ourselves. And that's all we can do. We can't worry about what nobody else is doing.
Right. My mama used to always say, you can't wear your heart on your sleeve.
Yeah.
So
Yeah.
it's,
Yeah.
I think again, we put these spaces on to manage the environments we in, but like you said,
Mhm.
everybody's going through their own independent struggles. Just because they didn't tell you they're going through something doesn't mean that they're not. So this is going to be my
Yeah.
kind of closing parting words here is check on your strong friends. Like
That's
they
it.
need someone to call and check on them too. And don't just always assume that they're okay because they go through their own things too. So make sure you check on your strong friends. That's important.
That's it. That's it. I like it.
So Dawn, I cannot thank you enough. I'm going to stop here and see if anyone has any questions or comments. Please feel free to drop them in the chat. But before we wrap it up, again, I just want to give you a time, a quick moment to highlight Dust by Dawn. I'm going to drop your
Mhm.
website into
Okay.
the chat and just tell people about the products that you have and where they can
Yeah.
find you.
Yeah, absolutely. I own Dust to Dawn Cosmetics. We are a vegan, hyperallergenic, veteran-owned company. And so essentially we have everything from skincare to makeup. So we have face wash, toner, moisturizer, foundation, blush, lashes, lipstick, the whole gamut. If you walk into a MAC counter, we have everything that MAC has essentially.
What
And
clothing do you
so,
have on?
oh, this one I like to mix them. It's Charmed around here, and then the inside is Cerise. So it's two separate colors. Yeah. And our lipsticks are long wear, meaning that if you put them on, they're going to last. Our liquid lipsticks are going to last at least for 6 to 8 hours. So I stand by that. And our products are really good. They're not going to break you out, and they don't have a bunch of stuff in them that's going to have your skin all janky and stuff. It's a good brand. My studio is downtown Greensboro. You can do local shipping. I can meet you at the studio, but I ship all products the same day. I also provide micro shading. So if anybody has no brows or they want to have their brows filled in for permanently, like for 2 years, I do micro shading as well. I do makeup for events, weddings, and things of
Classes?
that nature. Yep, I do makeup classes. I do kids spa parties / makeup classes. Anything dealing with makeup, I do it.
Yes.
Yep,
So if you are local to the Triad, or hell, if you're just in North Carolina, hit her
yep,
up. Like she has a
yeah.
phenomenal product. And of course, everyone knows I'm Dr. Shinika. I coach around business mindset, nonprofits, and personal development. But my niche is really supporting high achieving women to identify hurdles and defeat mindset barriers so that they can create action plans to move forward. So if you find yourself where you need a coach around mindset and purpose, business, you're struggling with that, you can definitely check us out. And Dawn, I cannot thank you enough for taking time today to share this knowledge because I think that it is definitely needed. I hope you guys visit her site, Dust to Dawn Cosmetics, and you can also follow her on Facebook at the same handle, Dust to Dawn Cosmetics. Her products are amazing, and she has some really cute lip colors. And
Mhm.
yeah, and she does her classes, and she's always posting. So, Dawn, thank you so much for
You're
joining me.
welcome.
And
Thank you.
before we close out, is there anything else that you would like to share before we wrap this up?
I just wanted to say to everybody that's watching, just continue to show yourself grace, continue to show up. Anything that you want to do, you can do. I come from a framework of you can have your cake and eat it too. I have a
Mhm.
full-time career at the VA and I have a full-time business.
Right.
So anything you want to do, you can do it. Just prioritizing yourself, making goals for yourself, and then at the same time showing yourself grace. That's it.
Yeah, and I would just piggyback on that people make time for the things that they want to do. And
Mhm.
again, these jobs aren't loyal. So if you have an idea that you're interested in, like start somewhere. Like you got to
Yeah,
start somewhere because if you don't start or you don't try, you never know. So again, Dawn, thank you so much for your time. I'm going to
you're
go
welcome.
ahead and end our chat for this evening, but thank you guys, and I'll have this posted later. But this has been great, and I feel like it's a conversation that is definitely needed. And I'm pretty sure we'll have Dawn back, and maybe we can actually do some makeup tutorials.
That would be fun.
Yeah,
I'd
that
love
would
to
be
do
fun.
that.
I felt like the mental health piece was more important first, but
Yes,
I
it
would
is.
love
It
I would
is.
love to have that back. Like I've got another friend, Tiffany, that was on the first night. We didn't get into anything about financial literacy, so I got to have her back too. But this is what happens when you have these awesome women that they're just doing dope things, and so I'm just trying to use my platform to let my light shine while also someone else's. So again, thank you guys for everything. And Dawn, thank you again for taking time to speak with us this evening.
You're welcome.
All right, bye.